Next tonight.
Let's purge this collar without letting blood. This we prescribe, though no physician. Deep malice makes too deep incision. Forget, forgive, conclude, and be agreed. Our doctors say this is no month to bleed.
Well, there is a danger of malice entering the junior doctors' dispute. There have been 3 partial strikes by junior doctors in England since January, and on Tuesday they'll walk out of A&E units in the first of 2 planned days of total strikes in protest of the imposition of a new contract in the summer. However, leaked emails suggest that future action over the contract could be indefinite. One email from a member of the BMA Junior Doctors Committee reads, "Maybe if it all gets really bad, all the juniors will walk out forever." But how much support is there for an all-out strike? I'm joined now by 2 junior doctors, Kane, who works in palliative medicine in West Yorkshire, and Roshana Mehdian, who works in trauma surgery in London. And we should also say that junior doctors do all the way up to consultant grade, some senior, and you're a registrar, and you too. So let's just go straight away to say, how far are you prepared to go, Roshana?
In the big picture?
Yes.
Or I think we're prepared to go as far as we need to go to ensure that the contract that will come in for us is safe for us and for our patients. Unfortunately, we're not being listened to. Jeremy Hunt and Department of Health, they really want to listen to reason, so we're forced to take action like this, which, as you say, is unprecedented.
It is unprecedented, and indeed, although of course we know that consultants will cover on Tuesday, would you actually want to take a member of your family into hospital on Tuesday?
So I wouldn't have a problem with that, and I think the important point here is to contextualise this. The best way I can describe it is describe my own situation. In my own department, for instance, on a bank holiday, on a weekend, there would be 3 or 4 doctors covering emergency care. Now, over the strike, there will be 10 consultants covering emergency care. So that's twice as many doctors and the most highly trained doctors.
Kane, are you comfortable with this approach?
I think from the kind of argument that Roshana's making about safety, then yes, A&E departments and ITUs will be covered by consultant colleagues, and that will make them safe. But ultimately, at what cost? Because in order to provide that cover, they've had to cancel operations, they've had to cancel clinics. Now, some of those clinics will be very routine and can wait, but other ones are things like chemotherapy clinics, where patients are waiting to be reviewed to see whether they can get their next dose of chemotherapy. And I think that, for me, I'm not sure that I can justify taking away my labour so that consultants have to come away from dealing with those situations.
And what do you think the impact of this would be on the debate?
Well, I think very clearly Jeremy Hunt has tried very hard to paint the BMA as left-wing and militant and hard-line. And I think to some extent this plays very much into his narrative, that we're unreasonable, that we're not listening, that we're not talking. When actually we're very reasonable people. All of us are we go into medicine because we love our patients, and we go into medicine because we want to care for people. We want to talk to people. We don't want to be taking strike action. And I think that going on all that strike really feeds into Jeremy Hunt's narrative that we are unreasonable people.
So there is a difference of opinion among junior doctors. You do accept that it's not all junior doctors that want to take the line of coming out on an unprecedented strike, that there are doctors like Chris who have a different view.
I think there's a difference in assessment of the situation. So Chris is looking at it from a point of view of, you work in palliative care, so you see patients who take chemotherapy regularly. I work in orthopaedics, so I might not see that part of the NHS.
But you each know the other part of the NHS. You do know each other's jobs.
Absolutely.
And what Chris is saying is, in a way, that the BMA will come out of this badly, because actually it plays into he would say, Jeremy Hunt's hands, because of course you may well be depriving people of care that they very much need on these continuous days.
Sure.
And I wonder what you think of that.
So I'd like to allay Chris's fears a little, actually, and yourself and your viewers. I've actually seen a press release from NHS England that will come out on Monday, but I have seen it in advance, that says that priority has been given to, for instance, oncology and palliative care patients, and that they have had absolute plans from every trust in the United Kingdom to look at specifically the urgency of those clinics.
Right, but do you
I
be,
think
can I
I'd
just
say-
ask you, if these emails, there have been leaked emails, that actually BME Junior Doctors Committee say that the possibility is indefinite action, what's your reaction to that?
I personally cannot really countenance that, and I don't feel that really we can justify that. I think it really does make us look like the unreasonable people in this, and we're not, as I say. And I think I just want to address Roshana's point about NHS England saying that palliative care has been prioritised. My job's to build a relationship of trust with my patients. It takes a long time. People are very vulnerable. Even if my consultants come in, who are amazing and wonderful at their job, I've still lost that position of me from there, and I can't ask them to lay their death another day.
I wouldn't agree with that, because actually the conversations I have with my patients in my clinics when we talk about this, and they do bring it up, I haven't had a single patient who tells me they would lose trust in me. They say the exact opposite.
But
that
you're
they
prepared to
actually-
go out indefinitely if you have to.
I will assess that after the next strike.
Thank you both very much indeed.